Hi everyone, Rich Savel here. In today's educational video, we're going to be speaking about the flu vaccine and influenza. This educational video will help you understand what the flu is in a better understanding and how absolutely important it is for you and your family for you to receive the flu vaccine, certainly as a healthcare worker. To help us understand things, today our guest is Dr. Edward Chapnick. He's the Director of Infectious Disease here at Maimonides Medical Center. He's Vice Chairman of the Department of Medicine, and he's a Professor of Clinical Medicine at the Albert Einstein College of Medicine. Thank you so much for joining us, Dr. Chapnick.
Thanks for inviting me.
I wanted to let you begin by talking for a few minutes, a little background about the flu, what it is, what are our best approaches to trying to treat it.
Well, the flu is an infection caused by a virus. And one of the important things about that is antibiotics don't work at all for viral infections.
So our first question is, who should get the flu vaccine?
Well, the answer to this question is much simpler than it used to be. There it is. Everyone. The only qualifier here is it means everyone over the age of 6 months.
Okay. But certainly all adults.
All adults, yes.
And you said there are certain subgroups of people who especially should get it, and I was going to let you go over those.
Yes, and these groups are the people who could get especially severe cases of the flu or complications from the flu, and it includes young children, older adults, and especially pregnant women. Also, people with any chronic illnesses, and that can be almost any kind of chronic illness, and especially important, all of us, that being healthcare workers.
And you've explained this to me before, that to understand why it's so important for healthcare workers to receive the flu vaccine.
Yeah, it's really important because we need to protect our patients. The last thing we want to do as healthcare workers is have an illness ourselves that can make our patients even more sick, and in many cases can even kill our patients.
And we may not necessarily know we have it, but still give it to our patients in the initial phase of the illness?
That's exactly right. People with the flu are most contagious for a day or two before symptoms happen. So many people will say, well, I'll just stay home from work if I'm sick. But with the flu, that's not good enough, because by the time the person gets sick, they've already been spreading it to others for a couple of days.
I think that's a really, really important point.
It is.
So in this next part of our educational video, we were going to discuss some very common myths and misconceptions about the flu vaccine and let you try and clarify some of them. How's that sound?
That sounds great. And go ahead.
So the first one here is, I know somebody who got the flu when they got the flu shot last year, so I don't want it.
Right, this is a really common one, and some of you may know I've spent some time talking to people in the past who have refused to get flu shots. And these are things that people told me. So for this particular myth, first important point is it is impossible for the flu shot to cause the flu. It is not a live virus. It cannot cause the illness called the flu. People who get sick after the flu shot generally are sick due to something else, not anything related to the shot. The other part of this myth is people then actually might get the flu later in the flu season and say, well, that means the flu shot doesn't work.
We hear that frequently, right?
Nothing in medicine is 100%. When we say the flu shot works, that means it works anywhere from 50 to 80% of the time. Not 100, but certainly 50 to 80% is a lot better than 0%. So
this next one is a very important one, actually, and is quite serious in terms of saying that potentially autism could be I have a friend whose child got autism after getting vaccines. I'd like you to address that.
And autism is a horrible, horrible problem for a child to have. But certainly it's been proven, as well as we can prove anything, that autism has nothing to do with any vaccine and certainly has nothing to do with the flu shot. Unfortunately, children get autism in certain numbers, and those numbers are no different in children who got vaccines versus children who didn't get any vaccines.
And as you and I have talked about previously, unfortunately, this idea seems to have gotten stuck in popular understanding, and it's to the extent that science can prove that this is not true, it is simply not true.
It is not true. And in fact, the myth actually came from one study that was withdrawn by its authors because it was found to be fraudulent. And that study supposedly showed a link between an MMR vaccine and autism. It had absolutely nothing to do with flu shots.
And here you discuss somebody saying that it can injure my nerves. Why don't you talk about that?
Well, this one refers to a neurologic problem called Guillain-Barré syndrome, which was associated in very tiny numbers with the flu vaccine that was prepared for 1976 for a specific strain of swine flu. This is nothing like the swine flu that happened in 2008. And even in that case, it was a very tiny risk, somewhere around 1 in 100,000 people. Since then, there has been absolutely zero association of flu shots with the Guillain-Barré syndrome.
And this is an important one. I got the flu shot last year, or I had the flu last year. And please share with us your thoughts on these two comments.
Well, the first one refers to something that we discussed at the beginning of this video, and that is getting the flu shot last year may not give you protection against the flu this year because the virus changes every year. Having the flu previously for similar reasons doesn't make you immune from getting the flu in subsequent years. So neither of these is a reason to not take a flu shot.
So here, Dr. Chapnick, you wanted to point about what does it mean if, as a healthcare worker, we see one of our colleagues wearing a mask, and I was going to let you talk about that.
Yes, and this relates to New York State law, and that is that all of us as healthcare workers are required to either get a flu shot or sign a written form saying we're not taking the flu shot. Also, by a certain date, any healthcare worker who has not taken a flu shot will be required to wear a mask when in any patient care areas.
And then you and I wanted to finish up the video by going over some important dates and some other important information. So I guess this talks about when we have to have received it by.
Yes, well, as we discussed, every healthcare worker must either take a flu vaccine or sign a declination form indicating that they won't receive the vaccine. Here at Maimonides, the deadline for doing one of those options, and we hope we'll all choose to actually get the vaccine, will be December 1st. It's also important to realize anyone who does not meet this deadline won't be able to swipe in and out for their job.
And then there's another important point you brought up here if you do decline in terms of.
That's correct. And again, this is also New York State law that any healthcare worker who does not take the flu vaccine is required to wear a surgical mask, not only in any part of the hospital that's a direct patient care area, but in any part of the hospital that a patient may be present. What that means is elevators, lobbies, hallways.
Certainly outpatient areas.
Yes, any outpatient facilities, etc. And the deadline for masking for people who have not received the flu shot will be December 5th, unless the flu becomes widespread before that.
I see. And then I can talk to you about this. So you said there's going to be some vaccination pods. What are vaccination pods?
And these are points of distribution, and it's sort of a model that was developed in order to rapidly deliver vaccines, medications, etc. But what we found is it's a very good way to deliver influenza vaccine to large numbers of employees in a short time. So we'll have these points, or this point of distribution, set up on these dates and at these times, and employees will be able to come in, take care of the paperwork very quickly, and receive their flu shots.
Are these pods going to individual floors, or will they be announced where they'll be located?
It'll be announced where they'll be located, but they will be in the main hospital because we want to make it as easy as possible for people to come by. They'll also be very well staffed, so there won't be long wait times.
Ooh. So, okay, now what? So, as you can see here, these vaccines will be available in Employee Health Service, and you can get them in your department by calling Employee Health Service, or I believe calling your supervisor.
Yes, now the second point here is most important, and the Employee Health Service will come to areas of the hospital when it's scheduled by those departmental supervisors and immunize the whole department. It's a really convenient way to get the vaccine without even having to leave your workspace.
And the other important information, as you can see from this slide, is if you wish to call Employee Health Services to clarify either when the pods are going to be near you or when your particular unit will receive it, you call extension 8978. And Employee Health Services is located at 5008 Fort Hamilton Parkway. You can see the hours on the slide here. And I guess this is what it looks like. You get this particular badge to go next to your ID badge when you successfully get your vaccine.
That's correct. And those of you who have been here more than a year remember 2 years ago it was orange, last year it was blue, this year it's yellow. But this is a way we can easily determine which of us have received the flu vaccine and the very, very few, hopefully, who have not received it.
So I think some of the important points as we wrap things up, and I'd like to just make a couple really important points. As a healthcare provider, it's absolutely crucial that you receive your flu vaccine. This is caused by a virus. The virus changes every year. That's why it's really important for all of us to get our flu vaccine every year, and that even though it's not perfect, it's the best thing we have to prevent our patients from getting hurt by what can be a devastating illness.
I couldn't have said it better.
Thank you so much. We've been having our educational video guest is Dr. Ed Chapnick, Head of Infectious Disease and Vice Chairman of the Department of Medicine. Now go out and get your flu vaccine.